I was struck in reading some of the background that your center or network was labeled as the first national center for child maltreatment, and the first for a problem that's so pervasive, as you mentioned. Is there a reason for that? Why? I guess one could argue it took so long, or there weren't several of these prior to just a few years ago.
Right. Well, that's another good question, and it does underscore the fact that this public health problem is just starting to be recognized by large federal funding agencies such as the National Institutes of Health. So while there were centers of treatment or smaller research centers at various universities in the past, this is the first time that the NIH ever put any concerted effort into what they call capstone center grants. So this is a mechanism at NIH specifically produced to grow a new area of research and to form a national center or a national model of research and training around that area. So it was a competitive application process. And we put in a competitive application, competed against all established centers in the country, and we were awarded that amount of money. It's a large grant. And as you can kind of see from what I've spoken about, it takes a large commitment to do something as impactful as we're doing. From the basic research of how to stress get under your skin and how to optimize prevention and treatment for maltreated kids and those at risk, but also the education mission, and then the policy impact that we've been able to do with our center and the service that we have for various levels of governance at the state and federal levels takes a tremendous commitment and financial commitment and otherwise from places like the NIH. So it was the first time that NIH devoted that amount of resources to this problem specifically.
Mm-hmm. And maybe as we kind of move to wrap up here, it's a good segue into, I always like to talk about, why research and the need for research, because it's something that, people would like the results and the findings. You mentioned the policymakers a week before, hey, you want things, but it takes time and energy and effort to actually get that information. And it seems to me in kind of a simplest fashion, maybe for our viewers here, if we're thinking about situations that happen as a child and the impact that they may have throughout one's life as an adolescent, as a young adult, into adulthood. We might be talking about employment. We might be talking about the ability to sort of go and finish a college education. We might be talking about criminal activity. We're linking inherently sort of things that happen in one period of time to outcomes that happen years later. And we have to collect the data. We have to let time elapse, and that's an expensive undertaking. We need the resources to do that. So I assume that resonates with you, and I guess maybe this is just a pitch to, in layperson's terms, anything else you want to add to that, for people who, because sometimes I know in dealing with policy communities, people want to say, well, why do we need that research? That takes too long and it spends all kinds of money. I just want to solve the problem. But yet you can't solve the problem if you don't sort of understand it.
Well, yeah, it's sort of like, you wouldn't want to give a kid with cancer a lollipop and say, this will taste good for 15 minutes, right? And that's going to be enough. That's not an evidence-based approach to a real disease that we recognize as such. I mean, the same is true for anything that we're trying to eradicate. We need the biggest bang for the buck. And the biggest bang for the buck is that which is the most effective. And how do we know that things are effective? Because we do the right kind of research. It takes time and money to do research with unassailable methods. And my center is really concerned with raising the bar on our methods that we use for research, so that when we're in these policy meetings with policymakers, that our research cannot be brought down or assailed because of our methods. We try to do that in as rapid fashion as possible. So publishing, as soon as we can, not sitting on good data, but also translating in our academic journals, taking time in our conclusion sections to draw those public health implications, to draw those policy implications, so that congressional staffers can find our papers and find those gems in those papers and actually use those papers to fortify their arguments for policy change. I would also say that there are new innovations in our field, and I know in yours as well, where we're utilizing data that's already gathered. So we're utilizing administrative data sources, so federal and state data systems that can be linked to show that kids in one system impact the expenditures in another system. For example, we're linking our child welfare data to things like our juvenile justice data, our education data, our Medicare claims data, to show very rapidly in these sort of rapid trials that there are co-occurrences of expenditures across these systems, and that to keep kids from going in one system and preventing them from going into that system will prevent them from going into these other connected systems and have impact on these other connected systems. So there are ways that we can come together and utilize our sort of transdisciplinary expertise across our departments, across our fields, across economics, across health policy, across human development, across psychology, across biology, across pediatrics, to come together as a think tank of how we impact more directly, more rapidly, and with the largest amount of available data and expertise that will actually move the needle in health for these kids.
Yeah, and I'm going to add one more question here, maybe give you the opportunity to speak to this, because I know it's important. Again, oftentimes we can learn a lot by collecting data that is historically been in silos. So again, linking data on educational outcomes to health care claims to criminal justice or other sources. But oftentimes the concern that's often raised is privacy, in that sensitive data. And in this area, data is highly sensitive. We may be talking about criminal activity. We may be talking about allegations. We may be talking about, sensitive healthcare information, treatment information. Certainly privacy and following all applicable laws and HIPAA and so forth are important. But what would you say? What do you say? What would you say to those who may not see the value in the data, may have concerns about that, both in terms of how you handle it and do that in a way that can maximize the learning but still treat that appropriately?
Yeah, and I would say, indeed, privacy should be the thing that you uphold as the most precious, protecting kids and the privacy of those who are in these data systems. But there are ways to do that, right? There's infrastructure we now have here at Penn State that allows us to be able to receive sensitive, identifiable, and identified data that can be linked to other identified data in very secure situations, secure environments that are not linked, that cannot be hacked, and where there are very sophisticated data safety plans to allow that to happen. I mean, Department of Defense level security, right? We've had to build that infrastructure here at Penn State, and we have built that, and we have housed data since 2017 without incident. So there's a way to do this. There's also a way to honor the privacy statutes and not release that information in any way that where it can be identified in aggregate data, in reports that in no way can identify a certain case or a certain person. Right? So there's technology, there are ways to do this. There are other fields who have been doing this for decades. We just have to really catch up. We also have to let the public and providers understand that we have this level of data security here, that we do take this incredibly seriously, and we've not had a breach. The other thing to consider is the cost of not doing this. We collect these data. These data already exist. If these data cannot be used to better our quality assurance, to better our prevention, targeted prevention efforts, right, to better our treatment strategies and our quality improvement, why do we collect all these data? It's going to take people at the highest levels understanding sort of the equipoise of doing this, that by not utilizing the data, we're actually doing a disservice to those families who might be at risk or have already experienced this kind of devastation in their lives, and we're improving this for the next generation to come. So those are the kinds of things that we have to continually remind the public and providers and administrators about over and over and over again, that we do take this very seriously. But if we don't, we're missing a huge opportunity to really impact these public health problems.
Yeah, great. Well, I certainly appreciate your time. Let me ask, is there anything we haven't covered? Anything else that you think is important for those who will view and listen to this?
I just want to really emphasize that the group of faculty that we've been able to bring here to Penn State as a result of this cluster hire, it's just an amazing group of talented faculty. I can't say enough about our colleagues in nursing and in education and in sociology, criminology, and in psychology and in human development and in biobehavioral health and in pediatrics that are just top-notch people who are getting grants of their own, independent from our P50 Center. We have garnered over $42 million in federal funding in the last 7 years since this all started. So an amazing group of people. We come together, we care about each other, we nurture each other's careers. We have a lot of junior faculty who came as assistants who are now up for promotion. And it's just wonderful to see how this group has come together to really synthesize and gel into this synergistic opportunity that I think is really a model for this kind of cluster hire in the nation.
Great. Well, thank you so much for taking the time. We will make available the web link and information for the Child Maltreatment Solutions Network, as well as the center, so that anyone who wants to find more information knows how to contact you and some of those other faculty that you mentioned, and to really realize the contribution that Penn State's trying to make to this problem. So thank you.
Thank you so much for having me.